Hi, this is Ayesha Akhtar, Director of Education at the Epilepsy Foundation of Greater Chicago. Today I have with me an old friend of the foundation, also a member of our professional advisory board, Dr. Maggie McNulty of the Comprehensive Epilepsy Clinic at Rush. Welcome to my show.
Hi, thanks for having me. I really am happy to kind of talk to everyone more.
Awesome, thanks for being here. And I know you've been a really great supporter of the foundation for many years. You most recently presented at the Epilepsy Consumer Conference in November. I think we had the all-female panel that was a smash. So thanks for doing that.
Absolutely.
So today I wanted to share with the audience about a partnership that we've had for many, many years that some people may or may not know. I think it's one of the greatest stories we have at the foundation. So for years, EFGC has helped to facilitate a clinic through Rush, and now that clinic has moved to Oak Brook. And I would love for you to kind of share a little bit about that clinic and what services clients or patients can find at the epilepsy clinic at Oak Brook.
Sure. So yes, we are very, very fortunate to have partnered with the Epilepsy Foundation now at our Oak Brook location, which just within the last year or so, our Rush epilepsy specialists have been going there, or at least some of us have been there. And we are very fortunate to have dflader, which I'm sure many of you know, from the Epilepsy Foundation, be present at each of those clinics. And so it's a very unique opportunity for where the Epilepsy Foundation has direct contact with our patients who are being seen in the clinic. And this includes both new patients as well as returns. And so typically we'll have Debbie meet these patients, each and every one of them, after a visit, and she can go through the different services that the Epilepsy Foundation offers. And she's been a really valuable asset to our clinic and has helped many of our patients with different case management services, even psychotherapy evaluations, and just general needs and referrals for people who need more help and assistance.
Yeah, that's great. And these wraparound services that you're describing, it's kind of like a one-stop shop. And we wanted to make sure that we promoted the fact that we are able to help people who are uninsured and undocumented, that we do have support services for any of those kinds of people. So we definitely want people to be seen by an epilepsy specialist for sure. Can you talk a little bit about what a person can expect if they called to get an appointment and came to the clinic?
Sure. So, you know, things work, I think, pretty seamlessly at our Oak Brook location in particular. A patient is, once they come, they're brought back into our exam room almost immediately, and they stay there and kind of wrap up the whole visit through in that room even. And so then they will initially get their typical vital signs taken, like blood pressure, weight, all those types of things. And then the doctor will come into the room to meet the patient. And so we have both obviously new and return patients. And so for a new patient, typically that's about an hour-long visit where you're spending talking directly with the doctor about your experience with seizures. And so it's very important for the patient to bring in all the necessary information and details as best as they can remember about how their seizures started, and kind of with a timeline, what happens during the seizure. You're going to go into great detail about those types of things, as well as many other factors that delve into maybe why someone develops seizures or epilepsy. So risk factors in the remote past, as well as more recent potential risk factors. And so a lot of the visit is centered around getting that very detailed history, because when you're talking to a patient who has epilepsy, it's really important to try to figure out what type of epilepsy they have. And so the doctors figure that out by getting a detailed information about their seizures and their seizure history. And then all of our patients will have a neurological exam, and that includes memory and thinking test, because we know that memory and thinking is often affected in our patients who have epilepsy. So that's usually a vital part of our exam, as well as a general neurologic exam to see if there is anything else off with weakness or sensory changes that could contribute to why they might have seizures. Patients are also review, of course, what medications they are currently taking and how effective they are. And so it is helpful oftentimes for our patients to bring those medications in with them to the clinic visit, because sometimes it could be a weird formulation or the dose might be a little bit off. And so the doctors can look at that directly and be assured that everyone is on the same page. If you know a history of what past medications you have been on, that's also something important to bring and to go over with your doctor. Other things that might be helpful if it's a new visit is if you've had other testing, any imaging of your brain with MRIs or CAT scans, as well as any EEG reports that have been done in the past. Again, that all helps in helping the doctor to make a decision on what type of epilepsy you might have and how we might better treat you and what further steps need to be done to get you seizure free, because of course that is our goal for all of our patients, to be seizure free and of course without medication side effects. So that's generally how it goes. That, the doctor will go over the plan of care with the patient, if any further testing needs to be done, any lab work. And if lab work is done actually at our Oak Brook facility, we will have someone come directly to that room and draw the blood work there. And then you wrap up and set up your follow-up and you're on your way. So, it is a pretty seamless process. And then we also have, of course, the added benefit of Debbie, who comes in and talks to each of our patients at the end of the visit.
That's great. That's super comprehensive. And it's nice to hear that, you have definitely provided a great service for our clients. And I'd love for you to maybe share a couple things about how the foundation has been a great asset to the Rush Clinic.
Yeah. So there's probably, so many things, it's hard to kind of pin down one. I think some particular specific examples is I had a patient who had pretty severe autism and was nonverbal, and that family was really seemed like they were in desperate need. And so Debbie was able to give them many, many resources and make sure that they had all the proper potential state funding that they could get, and any other kind of support from a standpoint of helping the family in this very difficult situation where this young man with autism, his seizures were getting worse, but also his behavior was getting worse. So she offered many, many different resources. I've had other patients over the years also get involved with the art program with Studio E, and have had really great feedback about that program, and it's a good release. I'm also aware that, which I'm really excited about, is that the Epilepsy Foundation has put more effort, and not that they ever didn't put effort into this, but put more dedication to mental health services, and that's one of their new initiatives. And we know that so many of our patients with epilepsy have coexistent mood problems, anxiety, depression. And so the fact that our Epilepsy Foundation is highly aware of this and highly invested in this as well, where they're even setting up group therapy sessions. I haven't identified a patient that completely fits in this program yet, but this will be an invaluable resource for my patients and really all patients.
That's so great. Those are such great compliments. And you're right, like the comorbidities that we have found with people living with epilepsy and mood disorders and anxiety and depression, it's a lot going on, and we're really, really thrilled with our new clinical department that we're able to service those needs for sure. I think this is probably a good time to also just revisit the definition of an epileptologist. A lot of times when I'm going into schools and I talk about, go visit your epileptologist or seek out an epilepsy clinic, in Chicago, we are so lucky that, within any 25-mile drive you can take, you can find a level 3, level 4 clinic. Can you please give a great definition of what an epileptologist and why someone should come and see an epileptologist and not just a neurologist?
Sure. So as an epileptologist, everyone who's an epileptologist is also a neurologist. So to kind of go through that training, any neurologist does 4 years of medical school, followed by 4 years of residency, including kind of a year of internal medicine residency, where you're learning kind of the general basics of medicine and treating adults with a whole host of different medical problems. And then the last 3 years are dedicated to doing neurology. And so that could be many things. You do stroke, movement disorders, a whole host of different things, including epilepsy in that training. But then epileptologists, they typically do additional training either 1 or 2 years after they finish residency, really learning the intricacies of treating patients with epilepsy, so having more exposure to epilepsy patients in the clinic, as well as dedicating a lot of time to learn about EEG and different types of management or surgical management. So while a general neurologist really can treat any type of neurologic problem, an epileptologist really only specializes in treating epilepsy patients, and that's the bulk of their patient population. And so the advantage of seeing an epileptologist and being at an epilepsy center is that there are other options for treatment for our patients. So we know that about 2/3 of our patients will become seizure-free with the right medication and the right dose. But then there's about 1/3 of our patients who can, no matter what medicine is tried, they don't become seizure-free, and they're considered to have intractable epilepsy. And really, after failing 2 anti-seizure medicines, meaning seizures persisting, big seizures, little seizures, despite medications and doing everything right, you are considered to have intractable epilepsy. And if that's the case, you need to be evaluated for other options other than medications, because we know that the chances of the next medicine or the next medicine working is very, very low at that point. And so an epileptologist can properly evaluate you at one of the high epilepsy centers, level epilepsy centers, to see if maybe surgery is an option to treat and even cure your epilepsy. And so we have all of those resources available that a general neurologist might not have available.
Yeah, it's so important. And also, so many epileptologists have varying specialties and lines of interest. And I'm sure you, Dr. McNulty, you have your own sort of sets of passions. Could you share maybe what your particular interests are?
Sure. So I am very, very passionate about women with epilepsy in particular. And so that is an area that I'm passionate about, and I treat women with epilepsy. There's many women with epilepsy who have a pattern that's associated with their menstrual cycle or catamenial epilepsy. And so meaning that their seizures are enhanced at a different time of their menstrual cycle. And so lots of people who they first started having seizures, they might not initially recognize this pattern, the women, but as time goes on, they're like, oh, that seizure happened when I was on my period. And so there's different forms of treatment for that can be explored. And I partner with one of the gynecologists at Rush that is really great and is also interested in treating women with epilepsy and kind of other hormonal methods. The other thing, of course, is treating our pregnant women with epilepsy and kind of going into that whole family planning and preparing a woman for pregnancy is a huge step, because sometimes, people might have the misconception that people with epilepsy or women with epilepsy can't have children, but that's very untrue. And so that can be a very, rewarding process for me to get a woman, through a pregnancy, having a healthy baby. So that's really why I really like issues as it relates to women.
That's fantastic. I love that. And that's another great, education panel that we've had in the past several years at the consumer conference. And I continue to look forward to having more of those education seminars coming forward. But I just want to thank you for your time today. And of course, if people have more questions about the clinic, they can reach out to the foundation and we can definitely guide them in the direct way. But thank you so much for your time today, Dr. McNulty.
Thank you so much. I was so happy to talk to you today.
Yeah. Take care. I'll hope to see you in person soon.
Okay, yes, definitely.